Hello all. Here it is, a quick video to summarize some of the main points from the event that we did on assertiveness, the third part of the GPNI boundaries series. So I want to give you one tool to use, one concept about the reason why, and then a few ideas about how to implement assertiveness. Sometimes people worry if I get too assertive, oh, maybe I'll be aggressive or a bully, and I really don't want that. And I just want to say that's not proper assertiveness. We have to be clear there's a spectrum from passivity on one side to aggressiveness on the other, but assertiveness is actually somewhere in between. I wonder if you've seen any of those characters within your practice team. Maybe you can feel of a time whenever you were too passive, you should have stood up for a colleague or said something to a patient. So passivity, you get walked over. It pretends it doesn't care, apathetic, smiling on the outside but bitter underneath, and it doesn't lead to wellness. Aggression, on the other hand, at this far end of the spectrum, says I will trample over you if you don't get with my agenda. So I don't notice or care about how things affect you, and this really hurts relationships. Assertiveness is this middle area. It's about confidently standing up for yourself and having good boundaries without having to put someone else down, without having to win or be dominant. It's not about getting your own way, but about expressing your point of view. And you do have a right to have a point of view, but so does the other person. So if I asked you to put yourself on an X on this map between passivity and aggressiveness, I wonder where you would be on that scale at the moment. So here you go, one tool to use. Now this might seem a little bit cerebral, but some of you might like the idea of using a decision-making grid. So I want you to imagine two columns in a table with the cost and the benefit in the columns, and in the rows, being more assertive and not being more assertive. So what we're going to do is just take the emotion out of it. What are the benefits of not being more assertive? Well, I'm not going to risk creating a bad atmosphere or upsetting someone. And it actually feels quite nice to, be the really good guy, the nice guy, the hero, and I get to avoid any feelings of guilt. What are the costs of not being assertive? Well, if I don't have this conversation, things probably will just stay the same. And actually, then having the conversation becomes harder and harder as time goes on about something you should have dealt with months ago. Also internally, I might feel some inner turmoil and resentment. So yeah, then what are the costs of actually being more assertive? Well, I might have to have a pretty hard conversation here, and people might get upset because they're maybe used to getting their way with me, and all of a sudden I'm challenging them. What are the benefits of being more assertive? I get to be honest, to be my true self. I can own my feelings, what I need, and I have feelings too. Uh, Actually, I might end up getting treated better because people tend to treat you with the respect that you have for yourself. This might make me a better team player because people will know that I'm real and I'm readable. So the grid, it builds a case one way or the other. So it just helps you with your motivation. Next, here's one concept. If you need more convincing why about the reason to be more assertive, here's the reason: because I know my rights. So we've all got different places where we feel we get our identity from. One start, if you're interested, would be to do a Google image search for personal bill of rights. And what you'll find are things like this. I have the right to say, perceive, and think. I have the right to challenge someone and offer a different perspective. I have the right to ask for what I want. I have the right to be treated well and walk away if I'm not treated well. I can approach anyone I want to start a conversation, and I can end conversations whenever I want. I have the right to say no without giving any reason. I have the right to honour my need for rest. So one word of caution: if you take this too far, you'll end up in the misery that comes from being entitled, and we all know what that's like. Expecting everything to fall into your lap and forgetting that other people have rights too. But if you really feel boundaryless, maybe you need to develop your own Bill of Rights and just get clear on your worth there. All right, a few ideas about how to implement assertiveness. Mentally rehearse courageous conversations. We all need to be having a few courageous conversations every year. The hardest bit is often getting started. So plan the first 30 seconds and how you're going to open the conversation. So you might want to say to your partner, I need to have a conversation that I think will help our working relationship in the longer term. I'm always a fan of then getting their perspective first, but in terms of assertiveness, it's more about what we say. So tell the other person exactly how you see the situation or problem. Look, Mark, my perspective is that I've been left with a considerable of extra amount of work to do. This is unbalanced from the work that you're doing. Clearly communicate your feelings, your wants, and your needs. This frustrates me. It makes me feel like I'm still a junior member of staff and not equal to you as a partner here. I need you to look at this again with me and see if we can sort it out in a more equitable manner. Really notice the language and rehearse it. Use I statements and change your verbs. So I want, I need, I feel. This is the way to voice your own feelings and wishes from a personal position without expressing a judgment about the other person or blaming them for your feelings or blaming your feelings on them. So it's not that, oh, you know, we should or we could, but it's I won't, I can't, or I will. So, you know, as GPs, we do this with our patients. You know, I won't be issuing more diazepam today. I'd like to speak to you about this patient that I think will need to be seen. So the words we use are important, and sugarcoating leaves people confused about what you actually want from them. So don't shrink back from saying the hardest but most important truth. Final tips. Be prepared to use repetition, the broken record technique. I'm sorry, I can't do that. Oh, but what about... I'm sorry, I can't do that. Have you thought about this? I'm sorry, I can't do that. You might need to do it 10 times, who knows. Also, be clear about the consequences and be prepared to escalate the matter further. So this means getting firmer in your language and in the consequences, although remaining polite and respectful. Just telling them what you'll do if you're not satisfied. So maybe with the trainee, you know, John, this is the third time this week that I've had to speak to you about arriving late. If you're late once more this month, I'll have to activate the disciplinary process or whatever. So there you go. There's a lot more to it than this taster, but remember, many of you don't need to worry about becoming overly aggressive. One tool would be to consider using a decision-making grid to build a case for action. One concept is to reflect upon and really understand your rights and needs, and then communicate clearly by mentally rehearsing courageous conversations, using I statements with firm verbs, using repetition and escalation when necessary. I hope this has been helpful. All these things take practice and perseverance, but they start with one small step in the right direction, so give it a go. Don't forget, all GPs in Northern Ireland, you've got access to 5 sessions of free coaching and mentoring through the NIMTA mentoring website. So I'm always happy to use this for high performance coaching with people who want to develop skills just like this. I wish you well.